Hi, I'm Laura.
And I'm Christine, and together we're the founders of Pain Geeks.
Pain Geeks is a space for clinicians who care deeply about people in pain and who want to stay curious, challenged, and connected to how they practice.
We created Pain Geeks because we know how easy it is to feel isolated in this field. Pain care is complex, evidence is always evolving, and real conversations about the gray areas are often hard to find.
So, we built something we wish that we'd had years ago, a vibrant, welcoming community that brings together thoughtful clinicians, fresh research, and bold ideas from across the disciplines.
Each month, we dive into a new theme, one that stretches the way that we think about pain. We read and unpack a journal article, bring in voices from the humanities, host live discussions, and hold a book club that's anything but boring.
Our members are physios, OTs, medics, psychologists, academics, you name it. What they share is a hunger for better conversations, sharper thinking, and care that respects the full complexity of being in pain.
So if you're a clinician who loves a good rabbit hole, isn't afraid to question the status quo, and wants to keep growing, you'll fit right in. Welcome
Welcome to
to Pain
Geeks.
Geeks.
Lovely. So today we are going to talk about why we think that having a shared and flexible language for pain has been such a game changer for us in our work. And we're talking about this today because we have just released our freely downloadable terminologies guide. And I think this is just such a great opportunity for us to talk about why we thought that was an important thing to build for you guys, why we really want to support our community to understand and use the pain terminologies well. And I think this is a great opportunity for you, Christine, to really talk about why this was important because you really spearheaded this project and put all of the work in. So, like, why was this important to you to build this downloadable guide?
Yeah, so for me, I think it was really important to create something like this because I thought it would be very helpful for clinicians, because I knew it would be very helpful for me as well as a clinician. When I first started working as a physio, like the first few years were kind of a blur. It was a very messy experience, very overwhelming. But I remember very clearly having this thought, over and over again, that pain was the most important clinical encounter that I was experiencing on a daily basis, and that was what my job was about understanding this experience of pain. But it was also so clear that that was really confusing, and that meant a lot of different things to different people. So that was kind of where I think my curiosity began to spark. And I met Laura when I was sort of an earlier stage clinician, and she really helped me uh, come to this understanding that complexity was a reality in the clinic, and confusion, and it was something that I was going to have to learn to sort of um, just be able to deal with regularly, because that was actually a big part of my job. So that was also very interesting. And when I moved, a few years later into engaging more intentionally with the research and just trying to ground myself as a clinician, trying to understand things a little bit better, like it was so obvious that there's just so much language out there, and there's so many terminologies, so many things happening coming from different directions, that it's really important to, be reminding yourself of, okay, what does this mean? What should I be looking up now? What should I be focusing on? And really sort of grasping a learner's mindset and a growth mindset as a clinician, if you want to kind of bring yourself forward, because otherwise it's just a whirlwind of confusion, I think. And, I think it was also nice for me as an earlier stage clinician to see the shift of the IAS definition, because I think that kind of helped me from an early stage learned that definitions are not fixed necessarily, and that lots of people have different opinions about what the definition is or the reality of a situation or a terminology. And just to be a part of that discussion, or even just to witness that discussion, I think was really important from an early stage in my career, because it showed me, I guess, sort of the flexibility around that stuff, but how important it is that we have those discussions and try to anchor in to common terminology. Okay, so Laura, we're going to turn to you now. You've been working as a clinician for many, many years, and you're, you're also extremely interested in reading and research and terminologies. And, I've witnessed you be very precise in the way that we use language and understand things. So what brought you to this space where you are at now, and what influenced you to be interested in terminologies?
Yeah, so thanks for that, because I think my like what your reflection was is also something I resonate with so well, because I remember also that moment where I was like, "Ha, it's pain." Pain is the thing, and I don't really know anything about it. And I think that what you brought out in your reflection is something that I totally relate to as well. But then I think I would also add that not only does having a pain language help you understand what you're seeing in the clinic, because it's like this very strange experience of brush related pain. Knowing there's a word for that is quite empowering, I think, as a clinician, because all of a sudden it's not mysterious, right? It's something that people are working on. It's an established thing. It's a phenomena that other clinicians have seen, other patients have come forward with. Um, and I think that when I first started recognizing that I needed to go more into the pain literature as opposed to the sort of like manual therapy or exercise and rehab literature, um, it was really overwhelming and quite demotivating. I remember thinking, I don't belong here. That was the first thing. Like, why am I trying to read this really complex physiological stuff? I don't even know what they're saying. It was a totally different language, and I just felt like I was like reading the first paragraph could feel very exclusive. Like, um, I just couldn't really even get through. It was like a different language. So I was trying to understand and start picking at understanding that language a little bit more and a little bit more all the time. And I think if I really look back on it, like going to the Explain Pain course helped me a lot as a clinician because it gave me the words, but it also opened up this whole academic area, and having the words and alongside me as I'm reading some of the academic work really helped me to make sense and hold the frame of what the paper is trying to say. And that's why the terminology list of ISP has just always been such a helpful resource for me. I've always sort of had it as something that I share as far and as widely as I can with any clinician that's interested in pain. I'm like, hey, by the way, do you know that there's this resource that basically tells you what all the words mean? It's like a dictionary for pain.
Mm.
Like, um, and so it's just been really useful. And when I show it to patients, it's also really empowering because they're like, oh, okay, this is being worked on. Um, and so it not only helped me read the literature, but it helped me search better as well. So I was able to fill in better search strategies into the engine and figure out what it is and filter down what I'm reading as well. Um, so I think it's not only that it's a clinical tool, but it also helps us to explore the evidence, which then underpins our clinical practice, and becomes less exclusionary. Feels like there's less of a barrier. And I love what you said about how the definitions are changing. So this is the world of taxonomy, right? Where language is not a fixed truth. You know, the way we use it, the way that we use it can also change the meaning of the word. And I think we've seen this really, really most commonly with something like central sensitization. So, like when you think about the original definition of central sensitization, and many of us are still quite strict on this, that it is about, synaptic strengthening in the dorsal horn. But, culturally, those two words, that central sensitization has started to shift as well and to become sort of any kind of synaptic strengthening within the nervous system and almost like a kind of proxy word for chronic pain, which has pulled it away from its original meaning. And so when we're reading articles, if we understand that, we can get some insight into the perspective of the people who are writing it and how they're using that terminology, so that we don't end up in conflict with the article. We can just be like, okay, they're using this in that way. It doesn't mean you have to agree with it, but it helps you get insight into that paper. Um, and I think this is what I love the most. So when I'm working with clinicians or teaching clinicians, and I see them start to build this pain language, they start to get more comfortable in the complexity, like you said, because it can be really overwhelming. But if you've got a language for it, all of a sudden you've built in a feeling of a foundation, a feeling of a solid place to move from. And I think that is such a helpful bit. You don't, and I think just, to remind you, you don't have to agree with the definition, but to have a shared place where we can calibrate allows us to have a deeper conversation without conflict, or choosing which conflict you want to go into. Does that make sense?
Yeah, definitely. Yeah, and I really liked the when you use the word anchoring and how it, anchors us in our research or in our reading and all that kind of stuff. But I also think that that anchors us in our clinical practice in a few different ways. So, for example, when that realization of, okay, pain is different for everybody. So what does that mean for me now in my clinical practice when I have this person sitting in front of me? And I started to explore that with the person sitting in front of me and asking them questions, and you start to see more clearly how flexible and how different this experience, whatever you want to call it, is for different people. It really is a beautiful moment where you really start to incorporate more sort of flexibility into your practice, and where I think that also like anchors you into the space, because it helps you have like a shared understanding with the person who's sitting in front of you, right? Because the shared understanding in that moment, in that dynamic, in that relationship is the one of the most important things you're trying to achieve, I think, in your clinical practice. And as well, you can expand that further clinically, having an anchoring language with your interdisciplinary team, right? So if you are working on it in a team and you have this sort of shared language, that's going to be really helpful in a lot of different ways. And trying to come to that shared language can also bring up a lot of interesting discussions in your meetings, and can only be helpful, I think. And just the action of having those discussions as well is a really beautiful thing to do and to model in healthcare, which is something we also try to incorporate, of course, and do here with Pain Geeks. The process, right? The discussion process.
Yeah, absolutely. And I think you're right, and I just want to pick up on something you said because it was a really important point. Like having a shared understanding of the meaning of the words with your patient is such a clinically powerful uh, process. And when you say that, I think it's really easy for us to think that we might be talking about pain or ache or things like that. But actually, so many patients are coming through with really actually quite medical terminology in their pocket. So if you've a person come through and they know they've been given a diagnosis of neuropathy, well, that's also still a moment to just be like, okay, well, what does that mean to you? What have you understood about that word? And recognizing if they are quite far away from the definition, that's also a sign that there might be a helpful moment of pain education here, because that person isn't actually very informed now about the choices they're making because they don't have a good understanding as to how we in the medical field understand that word. Because there's been a lot of space for them to fill in the gaps, which is totally logical, completely understandable. But the way they filled in those gaps might not be helpful or accurate. And so even with patients, we can still be looking at these terminologies that they come through with, and developing that shared awareness. And also, it shows them that you do know what neuropathy is. And I mean, how reassuring is that for a patient, when you've been going around, or, with this word, or like you do know what fibromyalgia is, or you do know what sensitized nervous system means, and you can help somebody make sense of that. They have a more of a feeling that they can relax in your space, that they can trust you as a clinician and as a guide. Um, yeah, I think that's a really, really powerful point, Christine, that you made there. And yeah, I'm laughing because um, the conversation about having a shared language with your colleagues is such a prominent thing for me at the moment, as I moved into
Mhm.
a new pain team, and meeting all the anaesthetists and the pain nurses, and realizing just how much extra work that is when we aren't coming from a shared place. It make me laugh. But yeah, and this is why I love Pain Geeks, right? Because it is such a relief, because you walk into the digital space of Pain Geeks, and we've got this paper, and we might have that we're looking at, say, for example, allodynia, or we might be looking at, the big one, I think, is pain and nociception, the way that they sort of, a lot of articles might use that interchangeably, and we can just acknowledge that straight up and be like, okay, how are they using the word pain here? And we have an open discussion about that. And it helps us academically to, yeah, to understand when each other might have different perspectives on the same word, or we might have slightly different ways of understanding it. Um, and that's also really great, because it also gives us an opportunity to meet in this word. And it might be that I'm using it in one way and someone's using it in another way, and that gives me bigger insight into how I'm using it, and what it means, or vice versa. Or it's an opportunity for us to be like, actually, you know what, I don't really know what that means. Like, which happens all the time.
Mhm.
Because these words, they're not based on the English language as we know it now. They're often built with blocks of like Greek and Latin, and location. I mean, that's how these words are usually put together. So
Mhm.
I always think it's a great opportunity just to go back and remind ourselves of what it means. Um,
Yeah.
yeah.
And just to add on to that as well, like that's also part of the reason why we do two discussions around each paper every month, right? Because the first discussion is really also more about framing this. So if we notice that there are some heavy terminology, or, you know, some confusing or complex things that are really, kind of at the core of this paper we're reading or article, then we'll spend a little bit of time trying to prepare all of us to be able to engage with that article more easily. Because indeed, like, I like that you use the word relief, because I relate to that as well. That's the experience that I also have where every time we go into a discussion, because even if we like, just because something maybe is overwhelming or confusing, I find that this space still supports us to engage with it, right? And that is a relief, because I don't have to throw the paper out the window, and I don't have to like give up. I can just keep trying, and there's a space for that, and that's Pain Geeks.
Absolutely. And like, it's not like you're doing something wrong because you don't understand this paper. And I really felt that, like, in the beginning when I first started reading this, I was like, why don't I know this? Why can't I read this? Like, I've just done my physiotherapy degree. I've just written a thesis. I'm evidence informed. I've been involved in this work for so long. Why can't I read this evidence? Why don't I understand what this is saying? And it's really easy to internalize that as a failing within you, but actually, it's because when we're focusing on pain, we are now moving into a whole, we're leveling up in terms of understanding the science, in terms of understanding that functional anatomy and that physiological connection between what a person is experiencing and what their body is doing. And it is a real shift. So it's not that you're doing something wrong, it's just that you haven't been given the tools to read this work yet. And when you are given those tools, it will get easier and your job will make more sense because pain is the thing you're working with. That's what it is. And that's exactly what Pain Geeks is for. It's a place where you know, I love it when we get like a new graduate or even a student come in, they're like, I'm not sure if I should be here. We're like, yes, you should. Just stay with us because like we'll help you. And like, you
Mhm.
know, don't expect yourself to understand all of this yet. And it is frustrating and it is hard, but don't throw it
Mhm.
away. Don't quit, right? Because this is going to help you.
Mhm.
And it's just such a loving space. And what I love as well, you know, for us being the founders, we're often coming in and leading this. Um, but what I love is that it's also a place where I can say, you know, yeah, okay, I am a pain specialized therapist. I teach, I go abroad and speak and all of this stuff. And people think that what luckily and beautifully, people think what I have to say is interesting, but I don't know everything. And there are loads of moments where I'm like, I don't really understand what this is, or can somebody help me unpick this? And that's what Pain Geeks is. It's a community. It's not somebody teaching you. It's we're going to read this paper because you reading it is much more powerful than me telling you how I interpreted that paper.
Mhm.
Yeah. Yeah. So yeah, I think it I do, yeah, I think it's been really helpful. And I think that having a language is always empowering, isn't it? You know, and that's what this freebie is all about. The reason why we're making this freely accessible is because we couldn't in good conscience create something like this and then keep it for behind a paywall. This needs to be something that we believe that everybody can access. And of course, the pain terminologies page on IASP is freely accessible. You just need to put it into Google and it's there. And we're not taking away from that. We're not changing their definitions. We're using their definition as a place for us to put in our sort of clinical, practical reflection over the top. And I think you've done a beautiful job of that, Christine. And I'm really glad that we've been able to produce this. And I hope people download it and use it. Um, and you know, if all it does is promote the fact that the pain terminologies page exists on the IAS website, I think we've done a good job, you know.
Mhm. Yeah. Yeah. So if people are looking to find that resource,
Hmm.
you can find it on our community platform. And we have a free portion of our community platform where you can see all of our reading resources. You can see the chat room that we have with all of our free and paid members as well. You can see in the open community free space, you can also see what we're reading. So if you sign up, you make a profile, you'll get right into that space, and then you're going to find this resource for you in the reading resources section, where you can also freely download it and use it how you see fit. And yeah, so we'll be really excited to have you read it and share with us your experience and let us know what you think and if it's helpful for you.
Exactly. So off like really go and like join our community and download that. Okay, so we're bringing this to an end, and I think we always think it's really helpful to just give like some practical tools, things that we've used or that we've learned over the years, and that I think we're currently using, right? So what's one like what's a practical tip or a couple of practical tips that you would give to people who are just uh yeah, starting to learn the pain terminologies and starting out in this sort of area.
Yeah, I think that, speaking from my own experience and what I've heard many other clinicians tell me as well on Pain Geeks and in my own clinic, I think that, what we've talked about as well in here is just this, how easily it can be to become overwhelmed by everything that you're trying to learn and trying to understand, and to just trying to refine that process a little bit of recognizing that coming up in yourself, right? Because there is nothing that we are going to be trying to better ourselves in where there's not going to be these sort of emotional barriers that kind of come up for us along the way. And, being overwhelmed, feeling anxious about not understanding things is certainly a prominent one when you're trying to further your academic reading skills or just engage with research or science. So that would be my first tip, is just start to recognize that a little bit more in yourself, so that you can, just name it a little bit better and see it for what it is, right? It's just a very normal experience. And secondly, it doesn't say anything about you as a person, but the second thing would be that, when we're overwhelmed, a nice thing, of course, is to just break things down, make it a little bit more simple. Don't try to read this whole guide in one sitting and understand everything and memorize it. Just pick one, definition, read it well, read the notes that come along with it, and maybe try to reflect on a time where you've seen that in the clinic. And I think that that is already a ton, of reflective work, processing, understanding, and learn of the learning process. And I think that will take you a long way. And what about you, Laura? What would you give as advice?
Yeah, so I think I always remember, so I always think about something that I think I learned from Lorimer Moseley really early on was like, it's not about it's the story that makes it sticky. Yeah. And he does this beautifully and in a way that I think is very his. And I remember trying to be like Mosley in the beginning and trying to copy his style, which now I it's just such a normal thing to do. But you have to find your own stories, right? And you have to, um, let yourself, like you said, sometimes the story isn't necessarily a make-believe story. It might be a story about a patient who demonstrated the thing that is behind the definition. So, when I think about allodynia, I have a very specific patient that comes straight to mind because allodynia was just such a prominent feature of his pain experience. And it was one of the first times when I'd really understood what that word meant. So that story comes through for me when I think about the word allodynia, and it helps me stay grounded in the technical definition because he was just sadly really a like textbook definition of allodynia. It was just so profoundly painful and disabling, but he was awesome as well, and we had a great patient therapist connection. So I would say, really try and start with stories, not necessarily the technical stuff. Yes, you've got the technical terminology, but that's there to help you understand the story and experience of the people that you're working with. And then just like you, I would think, break it down. And I think this helped me a lot was realizing that most of the technical terminologies are used building blocks from Latin or Greek roots. So like if you take the word hyperalgesia, which is one of the first ones that I learned because I was like, why are my patients having this crazy pain experience when I do gentle massage? So like I remember reading, oh, this is hyperalgesia. I get this, and understanding the difference between primary and secondary, so local and wider referred. So that was really helpful. But like the reason why we use that terminology is because hyper is the sort of root word for more, and algia is the root word for pain. So we're talking about an increased reporting of pain to a stimulus or event. And specifically with hyperalgesia, it's something that is usually considered to be a painful event. Um, like a pinch, right? Or a push. These can be uncomfortable experiences in and of themselves, but what we're looking for is that really heightened experience. And then, that brings us to that other problem, which I love about pain, because, just when you think you know what you're talking about, you realize you don't. And, like, what do we mean by heightened? And what do we mean by more than? This is where pain science can't help itself but become philosophical, because the science that we're looking at isn't an absolute truth. And this is the difference between science and philosophy. Philosophy wants to get down to the truth of it. It wants to keep seeking until it solves the problem. Um, and science is looking for, like, what is the most probable answer, like what fits, what is plausible based on the evidence that we have at the moment, knowing that in 10 years we're going to have new evidence, so we're going to have different plausibility. So when we're using a term like hyperalgesia, understanding that, how that's broken down, and knowing that, so that when you come into something else like hyperpathia, okay, well, I know what hyper means already, so now I need to figure out what pathia means. Well, it's and going into that, and I can't say that off the top of my head because I didn't prepare it, but hyperpathia is this delayed onset of pain, so a few hours or a day later. And this is why I think it's really helpful to have those, to break it down, and to take your time with it. Like you say, this is a marathon, not a sprint. Um, that's what this whole point is to sort of promote that and to help people get access to it that didn't have it before. And that's why I think this download is so cool. So excellent. I hope people go download it, and I hope this has been useful for you and that you can use this in your clinic. Yeah.
Yeah.
Sure. We practice
Sorry about
everything but the saying goodbye bits.
that.
Lovely. But I think that's it. So we'll bring this to an end now, and let us know if this has been useful. If you're in our community, head to our chat and let us know what you think. And share it. Share it widely.
Thanks, guys.